Okay. Another thing patients ask me a lot is, can I be on testosterone if it makes my blood thick? I've had people tell me that their doctor lowered their dose because their blood was thick, even though their level was already in the normal range. This is one of the misconceptions I've been battling with ever since I started treatment over 30 years ago, when I first became involved in this research. You see, testosterone does support blood count. Excessive testosterone levels can cause excessive blood counts, but there is no proof that normal levels of testosterone by themselves will cause excessive amounts of blood or thick blood. Let me say that again. There are no properly designed studies that demonstrate that testosterone on its own, when it's dosed appropriately, will cause excessive thickness of the blood. In fact, we have been studying that issue for 30 years. We make sure that patients are not overly treated. And if they still have thick blood, then we have worked them up for known causes of thick blood. So some of them very serious issues, like sleep apnea with low oxygen at night and low oxygen from COPD, or genetic causes like polycythemia vera. In point of fact, in 95% of cases, we have found a secondary condition that causes that elevation of blood, and we assume that the remainder 5% are probably from genetic causes that we have not unraveled the exact genetics, the basis of the exact genetics for. So in point of fact, to not investigate that, that is having thick blood on normal levels, is, in my opinion, malpractice. There are very serious conditions that commonly are associated with that need to be addressed. In fact, a recent study showed that 80% of people with thick blood and testosterone had significant sleep apnea. So this is an important issue. If you've got thick blood, it needs to be evaluated if your testosterone levels are within the normal range. Now, on top of that, if you fix the underlying problem, there's no reason that you shouldn't be able to have the testosterone levels in the physiologic range that give you the optimal improvement. The answer isn't to lower your testosterone if that thickness occurred on normal levels of replacement. The answer is to discover what the cause is, treat it, and then treat the patient with the optimal levels of testosterone for their symptom improvement. Check it out.